Hi, I'm Hilary Talbot, acupuncture physician and clinical herbalist. Today we will be discussing acupressure for hernias. Now, as you know, there are many different types of hernias, umbilical as well as hiatal. So it's important to differentiate which hernia you're experiencing in order to get an accurate treatment. But one point that I often find effective, no matter what the case of the hernia is pericardium 6. This is a point that I show and talk about a lot, and it's a pretty powerful point, located on the inside of the wrist bones in between the two tendons of the wrist, just after the vein crosses. Now, I often show this point for acidity, reflux, nausea, motion sickness, and it works for all of those. But the reason that it works for hernias is because it has kind of an amplifying effect on the entire digestion system, as well as its ability to reduce stress, which is also usually a component with a hernia. And if it wasn't before, it most certainly is once you have one, because it's quite uncomfortable, and in most of us that causes some stress. So using this point to stimulate can also can help affect the symptoms that we associate with a hernia. But as I said before, it's important to understand what type of hernia that you actually have, as well as the pattern of disharmony that got you there in the first place. Your local acupuncture physician can help do this by diagnosing you, and in addition to that, give you acupressure points that are specific to you, as well as lifestyle recommendations to help it from happening again. I'm Hilary Talbot, and that was Acupressure for Hernias.